When it comes to skin cancer, melanoma is less common, but it is certainly more serious. Melanomas may often be brown or black, but they can appear pink, tan, even white. And surgical oncologist Dr. Vadim Gущин is back. He's from Mercy Medical Center, and we're going to talk more about what's really a scary disease, a very scary sentence. Essentially, if I'm sitting across the desk from someone like you and melanoma is the word that escapes your lips, what are the current survival rates? What's the current picture of melanoma?
Well, for practical purposes, we divide melanoma into two categories, a good one and a bad one. Fortunately, the majority of patients have a good one, meaning that the melanoma that, if excised completely, does not go to other organs, to lymph nodes, and patients survive very well. So the outcomes for these patients are very good in the oncology world. About 8 out of 10 patients will survive 5 to 10 years.
Wow. Okay. All right. Which is still scary that that's the good news.
Yeah, it is a good news. The bad news is that you patients can still get bad melanomas, and sometimes very difficult to distinguish from the good counterparts. And that's where we made the recent advances with targeted therapies and immunotherapies. Again, you don't want to use these advances, but we certainly made some progress.
And that's encouraging, of course. Have we determined what role the sun plays versus heredity, for instance? Do we have any sense of kind of what that cocktail looks like for patients?
It's a very good question. The majority of melanomas are caused by the sun exposure. And actually, it's directly related to sunburns when people are younger, before they are 15 or so. And that's the majority. Only a few percentage points patients will develop melanoma because of bad genes.
Which, I mean, in some senses is good news, because that means that they're largely preventable with good practices. What is kind of the going philosophy? Is it still SPF of 30 every day? What do you recommend to patients?
Well, I recommend to patients to care for their children, because that's where the main focus of the prevention should come from. And whatever it takes, don't allow the sunburns to develop, whether it don't show up under the sun, from like sun-active hours. Wear protective clothing, and if you have to be on the beach or somewhere open, wear SPF of 30 and up.
All the things that we can do to prevent.
Absolutely.
Are there some categories who are more at risk, some categories of people of the population?
Well,
I mean, obviously you mentioned young people, but aside from that demographic.
Well, people with fair skin. Yeah, exactly. Redheads, blondes with blue eyes and fair skin. A lot of freckles. Be careful in San Diego. Be careful.
Yes. I'm already quite cautious. Unfortunately for me and for so many others, the damage was done in childhood. So trying to make up for it now as an adult and with my kids. So thank you. Dr. Vadim Gущin, always good to have you. Always an interesting conversation. Thank you so much.
Thank you.
Big game coming up for the Ravens.